Good day everyone, I'm Jan Allen M. Distao from BSN1C Group 2 and today I'm going to perform a return demonstration on assessing the abdomen. So moving on to the preparatory phase, first is we're going to review the client's previous medical records if available. Then you're going to determine the scope of assessment needed and prepare the necessary equipment. This is for easy access of equipment and so that the procedure will run smoothly. Then next is you're going to perform hand washing and don gloves if deemed necessary. So here I have a alcohol-based hand rub and I'm going to perform hand hygiene. Next is you're going to assemble equipment and the supplies needed. So here are my equipments. The next is you're going to introduce self to the client and verify the client's identity. So good day sir, I'm your nurse student for today, or student nurse for today. My name is Jan Allen M. Distajo. And may I ask your name sir?
June Mark Melocotones,
Your birthday,
June 25, 2006,
your religion,
Roman Catholic,
your civil status.
Singa.
Okay. So next is you're going to ask the client or the patient to empty the bladder before starting the procedure or beginning the examination. So I want you sir to empty your bladder basin gusto ka mangi sir. So basin gusto ka mag-urinate sir basin mag-empty ka sa bladder.
Okay, nurse.
You're done urinating sir? Then you're going to position the patient comfortably and provide privacy. So let's just assume that we are in the hospital setting and we have curtains here. So we're going to close the curtains and as well as the door and the windows of the room. So they should be closed to keep the patient at ease and comfortable. So are you comfortable with your position, sir?
Yes, nurse.
Okay. Then let's move on. Okay. Let's start the procedure. Then moving on to the assessment phase is visual inspection of the abdomen. So we're going to observe the coloration of the skin. Then we're going to note the vascularity of the abdominal skin. And then we're going to inspect for scars, its length, shapes, lines, and any specific characteristics. So sir, I want you to lay down sir and I'm going to drape you. So we're going to expose your abdomen area sir. Sige sir, higda sir. Okay. Then I want you to expose your abdomen area sir. Ayan na sir. So we're going to inspect for any coloration of the skin. Then next is you're going to assess for lesions and rashes. So you're going to inspect the umbilicus also. Then you're going to note the color, the location, and contours. Okay, we're going to check for any rashes, sir. Okay. Then next is you're going to inspect the abdominal contour and you're sitting at the patient's side. Look across the abdomen at the head at a level slightly higher than the patient's abdomen. Okay, sir. We're going to inspect the abdominal contour. Okay. Then we're going to inspect the area between the lower ribs and pubic bone and assess for abdominal symmetry and movement when the patient breathes. So we're going to observe for peristaltic waves. Okay, sir, I'm going to ask you to normal breath lang, sir, ha? Normal breathing, sir. Sige, sir, inhale, exhale lang gyapon, sir. Normal lang, sir. Sige, sir, start. Okay. Then moving on to the assessing for bowel sounds. So place the diaphragm of the stethoscope in the patient's abdomen and make sure that it is warm. So also you're going to apply light pressure or simply rest the stethoscope on the tender abdomen. So we're going to keep our abdomen, our stethoscope first. We're going to keep it warm. Okay, sir, ako na ni, pwede ba na ako, sir, kunin ako stethoscope sa imong abdomen, sir?
Pwede.
Okay. Then moving on to the assessing for bowel sounds. So first is you're going to place the diaphragm of the stethoscope on the patient's abdomen and you're going to make sure that it is warm. Then apply light pressure or simply rest the stethoscope on a tender abdomen. Then prior to doing that, you're going to begin in the right lower quadrant and proceed clockwise, covering all quadrants. So listen for at least 5 minutes before determining that no bowel sounds are present and that the bowels are silent. So also you're going to auscultate for vascular sounds. Listen for venous hum. Okay. You're going to keep your stethoscope warm. Okay, sir. Ako na i-auscultate ang imong abdomen, sir. Okay lang ba sa imo na, sir?
Nice.
Then also, lastly, you're going to auscultate for friction rub over the liver and spleen. Okay, normal breath lang, sir. Then moving on to the assessing the tone and the liver span in both lower and upper border. So you're going to percuss for tone lightly and systematically in all quadrants. Next is to assess the lower border of the liver. So you're going to begin in the right lower quadrant at the mid clavicular line and percuss upward. So you're going to note the change from tympani to dullness and mark the point. So next is you're going to ask the client to take a deep breath and hold, then repeat the procedure. So remind the patient to exhale after percussing. So karon sir, mag-assess ko sa imo lower border this liver. So So, I want you to take a deep breath, sir. Tapos, i-hold nimo, sir, ha? Okay. Nurse. So,
Okay, nice.
sige, inhale. I-hold, sir. Exhale. Again, inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay. Next is to assess the upper border of the liver. So first is you're going to percuss over the upper right chest at the mid-clavicular line and percuss downward. So you're going to mark that point and note the change from lung resonance to liver dullness and mark that point also. Then you're going to measure the distance between the two marks for the liver span and repeat percussion of the liver at the mid-sternal line and percuss the spleen. So, karon sir. Mag-percuss ko sa imong upper right chest. Sir. Normal breath lang, sir. So, mag-percuss ko sa imong spleen, sir. Okay. Next is you're going to perform blunt percussion on the liver and the kidneys. So, percuss the liver by placing your left hand flat against the lower right anterior rib cage. Then you're going to use the ulnar side of your right fist to strike your left hand. Then percuss kidneys at the costovertebral angles over the 12th rib. So karon sir, mag-precast ko sa imong liver. So, then on light palpation, so you're going to identify areas of tenderness and muscular resistance. And you're going to use fingertips in doing palpation, starting in non-tender quadrant. Then you're going to compress to a depth of 1 centimeter in a dipping motion, and gently lift the fingers and move to the next area. So karon sir, mag-identify ta sa areas of tenderness sa mga non-tender quadrant. Okay. Tell me if naisakit sir ha or dili ha, okay? Sakit. 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 Okay. Then moving on to the deep palpation. So deeply palpate all quadrants to delineate abdominal organs and detect subtle masses. So use palmar surface of the fingers and compress to a maximum depth of 5 to 6 centimeters. So karon sir, magpalpate ko sa imong kuan sir for sa imong abdominal organs so that we can detect subtle masses, okay? Mag-ingon lang gyapon kag sakit sir ha. Sakit. Sakit. So in this, you're going to perform bimanual palpation if you encounter resistance or to assess deeper structures. So you're going to palpate for masses, and you're going to note the location as well as the size and the consistency, shape, demarcation, pulsatility, tenderness, and mobility. Sakit sir. Sakit. 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 Okay.